80% of people realise that the nation's becoming a little less healthy, so there is interest and general view that we need to do something about it. But the other thing is we're not really active at doing anything about it per se. If you look at different groups, it was very interesting that the millennial kind of target group are very active in maybe gathering data and monitoring their own health, but they are a little bit confused. They're getting a lot of data and they're not really sure what they can do with this data. It's not really actionable for them. We have another group that is actually very confident that they're managing their health in a big way, which is maybe the 55 to 65-year-old cohort. But actually, when you ask them deeper, what are they really doing? They're saying, well, I weigh myself every day and I visit my doctor occasionally and I brush my teeth. So in terms of active engagement in managing your health, it's a little bit passive, I would say. And then even more, I think there's the really nice challenge is the perception gap between the patients and the professionals. I think the report says something like 19% of doctors believe that their patients don't have enough information to manage their own health. Now the patient comes armed with all sorts of data that is very generic, and they draw perhaps sometimes the wrong conclusions. A minor ailment is suddenly a major disease. So I think what we see, from a Philip's perspective, is that the challenge for us clearly is in can we help people in the area of prevention? Because we see there's the aging demographic, we see that there's too much burden within the sort of treatment and diagnostic side of things. And if we can ease that burden through encouraging people, creating devices, programs, and also changing behavior, we can sort of reduce a little bit the burden and the impact by keeping people out of the system where we can.
I think one thing that sometimes is not recognised is the good quality of care that the NHS actually delivers. I mean, there's been some recent work looking at health systems of different developed countries, the States, Canada, Australia, and actually found that Britain had ranked very highly in a number of different areas and actually produced good health services at low cost. So sometimes we don't actually sort of celebrate the strengths, I think, so that's something to bear in mind. But sort of advocate for the inclusion of behavioural science and behavioural scientists if we want to understand and support behaviour change. Careful about jumping into educating patients or encouraging people to take control, because we do know about this implementation action gap. Often people know what the problem is, but they don't necessarily change their behaviour. And some interventions based on training, patient education, can also be quite expensive for the amount of change in behaviour that is delivered. So I think that's, to sort of conclude, I think there's great potential, great alignment between digital and behavioural science. It's an area of priority for Public Health England. And there's, great potential, and it's going to be really exciting over the next decade, 2 decades, to actually sort of see how digital and behavioural science really come together to support people to improve their health outcomes and live healthier lives.
We must never lose track of the fact this is about technology. Technology is just an enabler. This is about human beings and the ability the opportunity we have to support them to live those better, healthier lives. And just to leave you with one example, homeless man in Hull, Ron, 53, living in a tent on a trunk road outside the city, suffering from a variety of different sicknesses, was rescued by a charity that wanted to help him get back to work, so took him into a hostel. He agreed to go, and they realised actually the reason he hadn't dealt with his health was because he'd been terrorised and intimidated by the receptionist at the GP surgery he had previously been to, and just decided he was never going to go back there, and got progressively more sick. He arrived in this hostel where they happened to be running a programme that NHS England funds called Widening Digital Participation, a programme to try and train citizens to learn how to use the internet, learn how to access NHS Choices and other health information services. And he took to it like a duck to water, and he was in seconds, having learned how to use a computer for the first time, realised that there were a number of GP practices in Hull which offered online booked appointments, where there was no need to speak to a receptionist at all, and where one of them, he discovered, would also take an email from you describing what it was you wanted to talk to them about. So he did both of those things, booked the appointment, sent the email, went into the GP practice. He had explained to them that he wasn't good with intimidating behaviour. They behaved correctly, and now he is, glad to say, a very regular consumer of that service and back to better health. and indeed now in employment. So I think at the end of the day, some of this is we mustn't forget that this is not really about digital, nor is it about data ultimately. It is about improving human beings' ability to live fulfilled and healthy lives.